Hi, this is Dr. Karen Becker, and today I have a very special guest. My guest, Dr. Ronald Schultz, who is here with us. Actually, I'm at his facility at the University of Wisconsin-Madison School of Veterinary Medicine. Dr. Schultz heads up the Pathobiological Sciences Department. Thank you so much for joining us.
Thank you for coming.
It's a cold day here in Wisconsin. Dr. Schultz, prior to the interview, was telling me a little bit about how when he arrived here 29 years ago?
29 years ago.
29 years ago, he was the sole, I call him an immunologist, and veterinary immunology is really where his specialty is in terms of focus for education and research. But he came here as the first pathobiological sciences person.
Correct.
And you now, tell me a little bit about your department.
Well, we now have about 150 faculty, staff, and students in the department. It's the largest of the 4 departments here in the school. And we have responsibility for a variety of subjects, including bacteriology, immunology, virology, parasitology, public health, epidemiology, and clinical and anatomic pathology. So it is a big group, yes, and an important group within any veterinary school.
Yes, it is. Part of the reason that I was so excited about having Dr. Schultz join us today is that if you begin thinking about vaccine decisions for your pets, you will absolutely come across not only Dr. Schultz's information, but he's involved in about every aspect of the vaccine topic, from working with vaccine manufacturers, putting together protocols, testing protocols. He's the man that's actually in the lab doing the research, which is, it's an honor to have you here with us. So in light of all of that information, many of you on the Healthy Pets website have questioned me about what to do about vaccines. It's probably one of the most hotly debated topics in veterinary medicine, and part of the reason it's so hotly debated is we of course want to be able to provide protection to our pets, but there's a big difference between providing protection in terms of giving them immunologic protection against life-threatening diseases and over-vaccination. And there's probably no one in the world more well-versed in this discussion than you. So my first question is this. Actually, I'm going to have you talk a little bit about the fact that when people first acquire a pet, many people don't, they're not able to correlate that we as people, we don't go in every year for a measles, mumps, rubella, DPT.
Correct.
We're vaccinated as kids, and then we have protection for life. When owners acquire their first dog or kitten and we bring them to the veterinarian, many veterinarians will say, we want to give your puppy or kitten a series of puppy shots, which are not necessarily any different than adult shots. And we want to give them maybe every 2 to 4 weeks. When I was working at the Humane Society, our protocol was giving a puppy a 5-way combination vaccine at 6, 8, 10, 12, 14, 16 weeks, and then an annual booster forever until they die. And at that time, now this was 20 years ago, at that time, that was considered a good idea to help provide optimal protection. And when I went to vet school and I learned that vaccines never wear off, I was a little confused about some of those recommendations coming from veterinarians. Can you expound a little bit, not only on the how dogs and cats develop immunity, but where you've seen the vaccine issue in your career, how you've seen things change?
Well, some of those questions were the questions that I asked back in the 70s. How often do we need to vaccinate dogs and cats? And what vaccines are actually required? And in those days, there were not a lot of vaccines, and so every time we got a new vaccine, we added it to the syringe. But by the 80s, we had 12, 14 different vaccines that were part of combination products. And from an immunologic standpoint, I knew that was not good. Also, from the standpoint of animals developing adverse reactions, the animals knew that that wasn't good. So back in the 70s, and this was something that was really not thought about very much, is a colleague of mine, Dr. Fred Scott, and I actually in 1978 came out with a vaccination protocol where we were suggesting that after the puppy shots or the kitten shots, the animal be vaccinated again at a year, but then every 3 years or less frequently. So this was in 1978 that we actually published that information. Well, of course, it takes a long time for change to occur.
30 years.
And yeah, it was actually in 1998 that the American Association of Feline Practitioners came out with guidelines that were very much like what we had published 20 years earlier. Now, what we have come to find out over those years, and of course we have a lot more vaccines today than we did then, but we know that there are certain vaccines that every dog or every cat should receive. And we have called those the core vaccines. And for the dog, it happens to be canine distemper, canine parvovirus, and canine adenovirus. And for the cat, it's feline panleukopenia, which is often referred to as distemper, but it's the feline parvovirus, which was the ancestral virus for canine parvo, and then feline calesi and feline herpes virus. And for both species, we have as core rabies vaccines. So those core vaccines are vaccines that every cat or every kitten and every puppy should receive, because the diseases can be very severe, and mortality from those particular infections can be as high as 60, 70, 80% in young animals. So that's why we consider those core. Now, the remaining vaccines, which there are many of for both the dog and cat, we refer to as non-core or optional. And so that's where we are right now with regard to the vaccines and which ones every animal should receive versus which ones only certain animals should receive, core versus non-core.
What are your thoughts in terms of indoor house cats, where exposure, in theory, if you have an educated owner that is not going to be introducing outdoor feral kitties into that confined environment, what are your thoughts on indoor house cat vaccines in terms of recurrent vaccination requirements?
Well, I think that, as I suggested, the core vaccines, the panleukopenia, if you want to look at it in a minimalistic way, every cat must get panleukopenia as a kitten. And the last dose of those kitten shots should be at 14 to 16 weeks. And the reason for that is, depending on the antibody that the mom has, that antibody is actually passed on to the kitten or to the puppy, and it becomes systemic. It will have a certain finite life, though, because it is passive, and about every 2 weeks it will decay, but depending on how high it is in the queen or in the bitch, that will determine which one of those puppy or kitten vaccinations actually immunize.
And you might want to mention, there's a difference between being vaccinated and being immunized.
Absolutely.
Yes.
We do a lot of vaccinating and sometimes don't do very much immunizing, especially in the puppy and the kitten, because that maternally derived antibody